Good morning. My name is Dr. Samantha Scott, and on today's episode, we will be talking about old age. Your pet's age in human years. The table above gives a comparison between dogs and cats' years to human years. This will help us relate their age to ours. So cats that are 7 years, it is estimated to be 54 human years, and those who are 20 years old, it is equivalent to 97 human years. In dogs, it varies with the weight of the dog. Small dogs, which are 0 to 20 pounds, medium, 21 to 50 pounds, large dogs, 51 to 90 pounds, and extra large, greater than 90 pounds. So in a 7-year-old small dog, they will be 44 human years, while the extra large dog, they will be 56 human years. The purpose of this episode is to make the owners aware of the problems associated with senior pets and to help them identify and care for pets that might be experiencing these age-related problems. Ideally, your older pets should be seen twice a year by your veterinarian. Early detection of certain diseases can help improve the quality of life of your senior pets. Always contact your veterinarian before starting to give your pets any medication or supplements. Any doubts about a particular problem, whether it is normal or not, contact your veterinarian. Common problems seen in senior pets are changes in appearance, changes in activity, in behavior, loss of senses, reduced function or failure of organs, cancer, and diseases of the mouth. We will first discuss the change in appearance. Graying hair coats. Like humans, turning gray is part of the normal aging process. As our pets get older, the pigment cells responsible for color stop being produced and cause the strands to be lighter in color. Next, loss of weight. Senior pets normally have a decrease in appetite, problems with digestion and/or absorption of food. Finally, weight gain or obesity. They generally have a decrease in activity which contributes to the weight gain. Owners have to monitor the amount of food their pets consume. Obesity causes diseases in our pets, for example, fatty liver in cats, diabetes in dogs and cats, and it also further complicates joint diseases and heart conditions. The next age-related problem is changes in activity. There is usually a decrease in activity. Your pet might avoid playing, running, they might have difficulty climbing stairs or jumping onto their favorite chair. This is caused by degenerative joint disease or osteoarthritis. They might also be sensitive to touch when the affected joints are palpated. Degenerative joint disease is a gradual deterioration of the articular cartilage within one or more joints. The top picture illustrates a healthy joint. The joint fluid and smooth articular cartilage reduce friction in the joint and allow the action of the joint to move smoothly. Just imagine if the cartilage is deteriorated, how painful that would be. The evolution of osteoarthritis is illustrated in the second picture. 1 and 2 depict bone and cartilage respectively of a healthy joint. 3 shows the thinning of the cartilage. 4 shows the cartilage remnants, and 5 the destruction of the cartilage. Some common signs of degenerative joint disease your pet might exhibit are sleeping more, slower walks, lameness, sensitive to touch on the affected areas, slow to stand from lying positions, difficulty getting into a vehicle, reluctance to go upstairs or jump on the bed. Damage caused by degenerative joint disease is irreversible. These are some tips to manage this disease, improving the quality of your animal's life. 1. The use of a low or restricted calorie diet. 2. Anti-inflammatory and pain-relieving medication, Some common ones used in the clinic are meloxicam and caprofen. 3. Popular supplements such as glucosamine, chondroitin sulfate, and omega-3 fatty acids. Glucosamine and chondroitin are structural components of cartilage. They have anti-inflammatory properties and also protect cells to help maintain cartilage structure. Hence, slow cartilage deterioration and reduction of pain. Omegas are powerful antioxidants that help relieve inflammation in the arthritic joints of dogs. The decrease in activity can also be caused by spondylosis or spondylosis deformans. The condition is associated with aging where the intervertebral disc slowly degenerates as part of the aging process and bone spurs develop to reestablish the stability of the weakened joint or joints. This bridging of the vertebrae can affect the nerves that are coming from the spinal cord, but most times it is an incidental finding on X-ray. Clinical signs include pain during manipulation of the back, pain on motion of the spinal column, and spasms in the back muscles. Management is similar to osteoarthritis. The third problem is changes in behavior. Older animals tend to have less energy and sleep a lot more. They may be less enthusiastic about greeting their owners. As dogs age, they lose cognitive function, resulting in symptoms similar to those of dementia or Alzheimer's in humans. Signs of dementia in dogs: getting lost around corners and doors, barking without reason, lack of interaction, loss of house training, decreased appetite, anxiety, no longer responding to their name or commands, extreme irritability, decreased desire to play, staring blankly at walls or at nothing, lack of self-grooming, and changes in sleep cycle. Cognitive dysfunction is not curable but can be managed. Healthy aging supplements such as specially formulated dog food for the senior dog that helps reduce the effects and promote brain function. Keeping your dog physically and mentally active could help prevent and slow the onset of cognitive dysfunction. This can be done by teaching them new tricks, playing games with them, regular exercise, regular socialization, and elimination of exposure to toxins. How do you take care of a dog with cognitive dysfunction? These are some things that can be done. Provide daytime activities and opportunities for play, structured social interaction, expose dog to sunlight to regulate the sleep-wake cycle, keep walking the dog, pet-proof your house, avoid rearranging furniture. Fourth problem is the loss of senses. Animals mainly suffer from hearing and vision loss, but can also lose their sense of smell. The tissues of the eyes and ears degenerate, causing varying degrees of deafness and blindness. One of the major contributors to blindness is cataracts, which is the increased opacity of the lens. Managing a pet that has impaired or complete loss of sight and hearing. The first signs are usually subtle. Your pet might be more easily spooked when someone approaches them, sometimes might even get aggressive. They are less responsive to commands. Keep water bowls, food, and pet's bed in the same place, so these objects would be easy to find. Don't change the surroundings. If changes need to be made, they should be small and gradual. Avoid making sudden movements, even if it's just to pet them, as these movements can frighten them. Non-verbal communication for the deaf dog. The fifth problem is reduced function or failure of organs. As your pet ages, their organs do not function as they should. We will briefly discuss the major organs, which are the heart, kidneys, and liver. The most common heart disease seen is congestive heart failure. The heart is not able to pump blood efficiently and fluid backs up in the heart, lungs, chest, and abdominal cavities. 10 signs of heart disease in dogs and cats are persistent cough, difficulty breathing, fainting or collapsing, abdominal swelling or distension, less tolerance to exercise, heart murmur, change in heart rate, change in body weight, restless or hiding, loss of appetite. Management of heart failure. This is an incurable disease, hence we can only manage the disease. Common treatments are vasodilators and diuretics. In the end stage of the disease, thoracocentesis and abdominocentesis needs to be performed to alleviate discomfort. At this stage, the quality of life of your pet needs to be evaluated. Sometimes the best option is to humanely euthanize. As your pet gets older, the function of their kidneys starts to decrease. Chronic kidney failure cannot be cured, but if caught early can be managed. We normally do blood tests to diagnose the function of the kidney. If there are increased levels of waste products in the blood, it's usually a sign of kidney disease. The kidneys, they normally filter from the blood these waste products and excrete them in the urine. Signs of kidney disease are increased thirst and urination, weight loss, vomiting and diarrhea, weakness, poor coat appearance, seizures, constipation, blood in the urine, decreased appetite, bad breath, sore mouth or mouth ulcers, lack of energy and increased sleeping, depression, acute blindness, uncoordinated gait, and swelling of bone structure. Management of chronic kidney disease. 1. Medicinal. The main drug used to help manage kidney disease is vasodilators. Other drugs are used just to treat the symptoms. Example, an antiemetic for the vomiting dog. 2. Renal diet. The diet should be a gradual transition. These renal diets not only reduce the amounts of phosphorus but also reduce the amounts of protein and salts. They are also supplemented with omega-3 fatty acids. They are alkalinized to help offset the metabolic acidosis associated with kidney disease. Feline diets are often supplemented with potassium. Thirdly, fluid therapy. When the waste products are excessively high, fluid therapy can be used. It acts like dialysis in humans to flush the waste products out. Once these values are not improving, your pet is not eating and lethargic, it is usually the end stage of renal disease, and the quality of your pet's life should be evaluated. Sometimes the best solution to end suffering is euthanasia. Liver disease is detected by blood tests. Common signs are seen in the later stages of the disease. Gastrointestinal imbalances, example, diarrhea, constipation, vomiting, bloating, bad breath, loss of appetite, weight loss, excess urination, excess thirst, excessive drooling, personality change, example, depression, lethargy, anxiety, skin problems, example, acne, psoriasis, rashes, jaundice, seizures in advanced stages. Management of liver disease or liver failure. In the case of long-term and end-stage liver disease, supportive treatment is needed to slow the progression of the disease, minimizing complications and allowing time for the liver to regenerate and compensate. 1. You use a change in diet to manage the disease. The diet usually recommended should include enough calories to maintain a normal weight. The next option is supplements. Supplements that protect the liver are Liv 52 and milk thistle, which can be used. Other supplements include B vitamins, vitamin K, and vitamin E. Another problem seen is incontinence. Incontinence is a lack of voluntary control over urination. This is caused by the weakening of the muscles that control the bladder. Sometimes the leaking of urine can be caused by disease processes, example urinary tract infections and cognitive dysfunction or dementia. Accidents are distressing to your pets, so they should not be punished. Give them more opportunities to go outside to do their business. The fifth age-related problem is cancer. Cancer is defined as uncontrolled growth of abnormal cells, but the signs and symptoms vary greatly depending on the location and type. I would stress again, monitoring your senior pet's overall health is important. 2 visits per year is highly recommended. Signs to look out for: unusual swellings, lumps or bumps that persist or continue to get larger, sores that do not heal, weight loss, loss of appetite. It's not normal to lose total interest in food. Problems breathing or going to the bathroom. Signs seen are normally wheezing or having trouble urinating or straining to defecate. Management of cancer in your pets. Early detection is key to improve the quality of your pet's life. Cancer can be managed depending on the severity and the location. Some tumors can be removed surgically, while others with drugs. In Belize, we normally do surgical removal and supportive care. The final age-related problem is diseases of the mouth. The most common issues of your senior pet would face are tooth decay and infected gums. The common signs include bad breath, swollen gums, broken and missing teeth, and loss of appetite. Serious infections can enter the bloodstream from the mouth because of the decaying teeth, so it should be treated as soon as possible. Management of these diseases. Prevention. Owners can brush their pets' teeth. This helps reduce the amount of plaque and hence reduce the chances of getting infected gums. If there are severe plaque buildup, routine teeth cleaning can be done by your veterinarian, and any severely infected teeth can be extracted. Key points to take home with you. Monitor and check your pets regularly. Look for new lumps, monitor their appetites, their behavior. Clean their teeth regularly. Visit your veterinarian twice a year for routine checks. All of these help with prevention and early detection of age-related diseases in your senior pets. Thank you for your attention. If there are any questions, they will be answered on next week's episode.